Prof Lucille Blumberg. She's Deputy Director from the Division of Public Health Surveillance and Response. She joins us on the line to talk about the suspected Ebola case in the country. Good to have you with us. From what we understand, we've tried to pin you down several times for an interview, and good to have you with us on the line today, Lucille. This crisis has been keeping you quite busy. From a South African perspective, are we managing to mitigate against the potential risk here?
I think the risk is low. I think there are a lot of things in place. And I think the most important is for healthcare workers, doctors and nurses to recognize any potential imported cases quickly and to contain this.
Have you been brought into the loop on the case at the Johannesburg General Hospital?
Yes, we've been involved. There is a system in place where doctors and nurses apply certain criteria to patients with fever from Africa, but particularly the 3 affected countries, and then we help to evaluate if anything further is needed. So, yes, we've been doing that quite actively at the moment.
Is there any danger in that one?
I think the risk is really low. And I think there will be a number of tests that we will do on patients where, there's a really low risk, but it would be, I think, reasonable to do the tests. I think good to try out the systems, and they've actually worked pretty well. And I think also to create confidence in the system. So I think, there are, outside of the definite cases, and we haven't had any of those, I think, reason to do some additional tests.
So the risk is low on the basis that, is it low that the person who has been brought in actually has Ebola?
No. The risk is low of the diagnosis of Ebola. So while he's been working in a country where Ebola is very well documented, it's Liberia, he's not had direct contact with patients who are infected, and that really is the only way that you can transmit Ebola to other people. It's not transmitted in any other way.
Lucille, we heard this morning, and it's an unconfirmed report, that there is an aircraft in quarantine at OR Tambo that's come from West Africa. You would know if that was true or not.
We don't have any direct flights from the outbreak-affected areas. You must remember that there are routine things in place for all aircraft. If there is an ill passenger on board, and there are many reasons for that, probably the most common would be gastroenteritis from food. Somebody would assess the patient, and then they would manage them. And then the pilot has to sign a document, a manifest, before passengers are released. So I think, people are being a bit more cautious at this time, but there is nothing to suggest that there is a case concern about Ebola at all.
Thank you so much to Professor Lucille Blumberg. She's the Deputy Director of the Division of Public Health and Surveillance and Response.